Thank you, Erica, and thanks to all the Voice San Diego staff who have made this week so interesting, and all of our guests over the last few days. It's been fascinating conversations. I'm very proud of the discussions and hope to live up to them today. I wish that we were together, that we could have a little drink before one of these and share ideas, and you could give me some tips and questions to ask, but we are still online. You know, this is good in a way, as a lot of people can access this that can't come to live events sometimes. And we also have that Spanish translation as well, which is cool. Thank you to Jasmine, who's doing that again. So I like to manage these debates as conversations and be pretty liberal about allowing backs and forth maybe. So we try to have a good exchange of ideas. If it crosses the line where somebody's taking up too much time, I'll try to make that known. Or if something's got out of hand as far as an exchange, then I'll try to control that. But let's respect each other's point of view and have a good conversation, I think, about the future of public safety in San Diego and law enforcement. So first off, I do want to set the stage about the sheriff's role. The sheriff is an elected official, obviously. That's why we're having this discussion. The sheriff and his or her deputies across the county do law enforcement work for unincorporated areas and assist in different areas and provide the actual services for cities that do not have their own police departments, like Encinitas, Imperial Beach, and others. They also, of course, run the county jails. We'll have some conversations about those. And the county, though, sets the budget for the sheriff's department. Now, it's a really interesting relationship and balance between those two different bodies that are still part of the same body. So we have a lot of things to go over, and I do like to jump in. Let's go over who is here. Alphabetically, we have John Hemmerling. He is an assistant city attorney for the city of San Diego, and he runs the city attorney's criminal division. So the city attorney does misdemeanor law enforcement within prosecutions, within the city of San Diego. The DA handles prosecutions for everything else, including misdemeanors and felonies outside the city of San Diego, and then just felonies within the city of San Diego. So Mr. Hemmerling runs that. Welcome, John.
Thank you, Scott.
And then we have Kelly Martinez. She is the top deputy at the Sheriff's Department right now. She's the undersheriff at the San Diego Sheriff's Department. Welcome, Kelly.
Thank you, Scott.
And then we have Dave Myers. He spent 3 decades, was it, in the Sheriff's Department and is now an activist and advocate for criminal justice reform. Welcome, Dave.
Thank you. Thanks for having me.
All right, I'm going to start with you, Ms. Martinez, since you're in the Sheriff's Department right now. You see how it's working every single day. Let's just start with you about this question. What is going wrong in the Sheriff's Department, and what is going right now?
Well, there's a lot going right. I'd like to start with that. We have a very robust and professional workforce. We have 4,600 approved positions, which is an increase over last year from the Board of Supervisors. They've increased our healthcare staffing, as well as a few of our deputy positions that'll support that healthcare staff. We've got a lot of initiatives that we're moving forward, both in partnership with the board, as well as with Health and Human Services and Behavioral Health Services. We are increasing our medically assisted treatment programs in the jail, which will increase health and safety for the individuals who are in our custody. We are doing more robust treatment of individuals in our custody. We currently have a lot of needs with that population, with the shifting and adjustment from AB 109 realignment, brought a lot more individuals into our care that need more health care. They have stronger health care needs, so we're working on that. We are increasing other initiatives within our county as far as the mental crisis response team. We're partnering with behavioral health on that, removing the law enforcement response from some of those psychiatric calls for service. The crisis stabilization units, their first one opened in Vista. That's been fantastic. It's my understanding we've had over 70 drop-offs already from law enforcement in the North County region, which is minimizing the time that people who are in mental health crisis are spending with law enforcement. It's down to about 10 to 15 minutes for a drop off versus 6 to 7 to 8 hours in an emergency room. So that's fantastic. That's all really good stuff that's going on. The Sheriff's Department has been working. We have a homeless assistant resource team. We've been working with county and NGO partners to place people who are homeless in our county areas. We've placed over 178 individuals in the last 2 years. We've got much more invested in community outreach and community inclusion. We've started our Spanish academies, citizens academies. We've got our second one going right now. Had over 100 individuals sign up to attend that. So that's helping with some of our outreach. We are just forming stronger partnerships throughout the region and with our county partners to provide better services. We're right now in the middle of the state audit of our jail deaths, which we've been participating with, and we're really looking forward to the results of that audit. We're increasing transparency. We're notifying the public sooner of jail deaths within 24 hours when they occur. We're going to be starting our pilot program for body-worn cameras in the jail, which we don't currently have. We just have them in our patrol operations. And we're just increasing connectivity between individuals who are in custody and their families in the community, increasing their ability for job training and counseling services in school. So we're doing a lot. It's a very, I could go on for a long time about all of the things we're doing. You also asked what's wrong with the Sheriff's Department. What's
going wrong?
I'm sorry.
What's going wrong? Let's do it.
What's going wrong? Okay. You know, honestly, it's been a tough year and a half. The resiliency of law enforcement has diminished somewhat. So we're working hard on wellness and resiliency with deputies in particular, but all of our staff. It's been tough for our healthcare providers in the jails. They're short-staffed. We've had mandated overtime for some time. We're working hard to increase the staffing so we can minimize the overtime that's occurring in the jails, not only for healthcare, but also for deputy sheriffs. Just doing a lot surrounding wellness. We've got a pretty robust peer support team. We've increased our chaplaincy program, which has been very helpful. We also have a contract with the Counseling Services International, which is helping a lot because we've honestly had higher incidents of stress on our staff, and we're concerned about their wellness and health. We're also concerned about retention and our ability to continue to hire with a strained workforce.
Did you say that the staffing has increased? Does that mean there's more deputies now than there were last year?
No, what I meant was we have more staff positions. We were provided resources to pay. We're at about 4,100 employees right now, but we have 4,600 positions. So we have a lot of people to hire. Those aren't all deputies. Some are nurses.
I got it. Yeah. Well, thank you for that. All right, we'll go to Mr. Hemmerling. What is your take on what's going right and wrong with the department right now?
Well, I would, obviously on some of the things that Kelly said about things that are going right, I would agree. I think that the law enforcement in general, it's a very tough job right now for whole variants of reasons. And I from conversations that I had, what I can tell, the professionals in the Sheriff's Department are still doing the great work every day on the patrol side, the court sides, the detention side. I think moving forward, they've had a lot of good discussion on some of the ways to move forward from where the Sheriff's Department has been and where they want to go, and some of those comments that Kelly mentioned. I think one of the things that needs to be looked at going forward, kind of what is problems with the Sheriff's Department that has to be faced. I think the issues that that's going on in the jails. There's been a lot of media on that. I know, Scott, you all have reported on it several times. The Union Tribune has reported on it. There's been several discussions about kind of things going on that's in the jails, and I think that's fair or unfair. It's something that needs to be addressed. We need to be transparent about it, and we need to find ways that we can solve that. The deputies in there and the staff that are in there, they're doing the best they can with what they have. But I think some of that, as it starts to build, whenever you start taking shots about concerns and problems there, it also affects the morale of the staff when they see that, and then that just kind of helps things continue along, not to, I should say, helps that those that have these concerns about what's going on in the jail. So I think that, you know, what it needs is from the top. If you have some strong leadership from the top, that shows professionalism, that shows fairness, that shows empathy, transparency, and a commitment to change when it's appropriate. Those are the kind of things that's going to make a difference. It's going to help those problems that they have.
Great, thank you. Mr. Myers?
Thanks, Scott. I think you kind of just hit the nail on the head. What's going good in the department right now is that there's an election. And because of the election, we're actually now finally hearing from sheriff's leadership about what's going on in the department and a willingness to at least have a conversation about change, a positive conversation about change. I started talking about jail deaths in 2017 very publicly. I didn't see anybody else talk to the County Law Enforcement Review Board about 22 jail death cases that were dismissed. You guys reported on it. I didn't hear anybody talk about the fact that within the Sheriff's Department, just in the last few years, deputies arrested for sexual assault, deputies sentenced to 80 years in prison for child molestation. There is a crisis in confidence within law enforcement, and we must talk about it consistently, not sweep it under the carpet, and not bring it up every 4 years just because there's an election. I've been talking about these issues for years. I ran on these issues last time. They have not gotten any better. In my over 3 decades within the Sheriff's Department, I have never seen the morale so bad. And I agree with John when he says leadership must take accountability for what's going on, and we don't see that happening. And I'm here consistently talking about the issues. Body-worn cameras. I proposed this 5 years ago to have body-worn cameras in the jails. All of a sudden there's an election. It's good that we're talking about it, and it's good that they're implementing it, but change has to come within the San Diego Sheriff's Department, and right now there's an opportunity. That's what I look forward to.
Okay, well, we're here to talk about law enforcement as it relates mostly to crime. We have Jesse Marks, I think he's watching. He did a piece earlier this week about the crime rate in San Diego County. There's been a lot of discussion about crime rates across the country. KUSI locally said it's skyrocketing and brought up a lot of fear about it. So he did some comparison. It looks like, in the early 90s that there were as many as 9 reports of violent crime, 9.7 reports of violent crime per 1,000 people. That's down to 3.64 this year, which is a little up from last year and the year before. I'd ask you, John, do you think that there is a skyrocketing crime wave that we need to be especially worried about?
Well, I think the stats show, as you mentioned, Scott, I think you mentioned it, 3.64 per 100,000. I think there's also shown that in the last 10 years, there has been an increase in violent crimes by about 7 or 8%. I think it's about what it is. So I don't know if skyrocketing is the right term, but I will say that in a modern society that we live in, where we have professional law enforcement and we have communities who are working together to collaborate on solving some of these problems, I would say that 7% may not sound like a lot, but I think it is a lot. It should be trending downward instead of trending up. I think some of the stats showed that I think homicides were down a little bit this year, and some other ones. But I think aggravated assaults and some burglaries were up. So I think skyrocketing is not probably the term that I would use, but it's unacceptable that crime is continuing to go up in today's day and age, whenever we should be working towards not just law enforcement, but the community as a whole should be working towards leveling that out and showing downward trends, working together with our law enforcement partners and finding ways on numerous criminal justice reforms that we can do where we can focus on violent crimes and gun violence to solve those problems instead of concentrating too much time on lower level misdemeanors and not dedicating the resources to the right spot. And if I'm the sheriff, you can bet that I'm going to be concentrating on violent crimes and gun violence. It's going to be some of the priorities, and we're going to put the proper staffing to address those priorities for sure.
Dave, what do you think about the state of crime right now in San Diego County, and how do you look at those numbers?
Sure. So how I look at, especially within the sheriff's jurisdiction, most of the sheriff's jurisdiction right now have seen double-digit increases in what you classified as violent crimes. Now, we could argue the percentages, but what I look at is the victims. What I look at is how is this impacting community members, whether it's an increase in 1, 20, or 30. And we must involve community-based organizations to assist law enforcement in especially preventing violent crimes in neighborhoods. And we don't do enough of that. We don't engage community-based organizations, let's say within the restorative justice process or anti-violence community-based organizations to assist law enforcement in neighborhoods, neighborhood parks, bringing youth together, bringing neighborhoods together to get people talking about violent crimes. And I mean, it's very solvable. I did it when I was there. I held our area station captains and staff accountable for their crime rates. They had to come in and explain to me what they were doing and what they were not doing. And we saw a consistent downward trend of crime rates. And I know we could do it. It's not going to take law enforcement all by itself. And again, I'm going back to that issue of morale. When you have the lowest morale that I've seen in over 3 decades in the sheriff's department under the current leadership, I think you are going to see the lack of willingness to engage in the community, to trust community members, and it's vice versa.
And Ms. Martinez, what's your take on the crime level right now?
Yeah, I would agree with John that you can't say that it's spiraling out of control or anything like that right now with the crime rates. They have increased. Sheriff's jurisdictions have some of the lowest crime rates in the region. However, certain crime types have gone up in the last year and a half. Some of that's, I think you have to compare some of the current crime rates to the pre-COVID crime rates, because I think COVID numbers are a little bit skewed since people were at home, businesses were closed, a lot of activity wasn't occurring that normally occurs. We are seeing spikes though, like I said, in certain crime types. Stolen vehicles have increased. We've seen some violent crimes using guns have increased. Our homicide rate has gone up. We're at 20 with the discovery of the woman yesterday, where we were at about 13 previously. So we have seen increases in that. Some of the drug offenses have increased. I think alcohol offenses have increased a little bit. Domestic violence has gone up a little bit. So we're addressing all of those. What Dave was talking about, the accountability meetings, we've done those for years and years. We haven't changed that. It's everyone's held accountable for their crime rates at their stations. We use information-led policing to identify crime trends. We've got a very robust crime analysis unit that's very good at looking at all of the different things that are occurring. We're working more with our communities in the areas of the old-fashioned SEPTED. You look at a park and you realize that it needs lighting, or that you need to fix the sidewalks, and that increases the ability for families to use those areas. It reduces crime. In Imperial Beach, they're doing a terrific job of that. The crime rates have just really plummeted over the years, the last several years of the sheriff's approach, and also the mayor and the rest of the city staff. They're looking at parks and how to improve city spaces. So there's a lot that can be done. There's a lot that's being done. And it's just, it's a conversation right now, particularly with all of the guns that we're recovering. We did a number of gun buybacks this year where we've recovered over 2,000 weapons, not just from the buybacks, but also from encounters in the field. And then also the ghost guns that, you keep seeing highlighted in new ordinances in the media.
So Dave said that you, let me ask you it this way. You said that you were facing a lot of wellness issues. I think that that's one way to put your officers or your deputies are struggling with mental health issues, or just the exhaustion that a lot of us or a lot of people are dealing with, but also maybe at a higher level. And Dave has described it as a morale crisis worse than ever. Is there a distinction in your mind between morale and what you described? Is there a morale crisis?
Well, I think it's a national strain on law enforcement in general. I don't think it's unique to San Diego. There's been a lot of pressures. There's been a lot of, just a lot of criticism and a lot of changes in legislation. A lot of, COVID was stressful for everyone in our society. And in particular, when you're working shift work, your children are no longer allowed to go to school. You've got to find daycare, which is shut down because of COVID. So there's been a lot of strain on everyone, on relationships, on families, on people working these long hours, overtime. We responded to civil unrest last year where there were weeks at a time where people were working 16-hour days. We had a large fire last year that impacted the workload. So I think all of that, it's just natural that's going to cause a strain on anyone.
I think they said
Scott, can I throw in something in there?
Yeah, sure.
Yeah, so it's interesting because all three of us appeared before the Deputy Sheriff Association for an endorsement, and actually one of the questions on their endorsement questionnaire had to do with them acknowledging the very low morale that's currently existing within a department. And I had a member come up to me later and say, I am exhausted. I am having to work overtime all the time. I have a developmentally disabled child at home, and the department will not do anything to accommodate me to see and care for that child. And that adds to the stress. That adds to the problem within the department.
Mm-hmm.
Scott, can I comment back? Because the question started with about crime stats and is it spiraling out of control? I want to get to, because I appreciate the comments that Dave made about some of the things that he's done when he was on the department to hold people accountable and monitoring those crime rates. But what I'm talking about, when I proposed earlier, is that, looking at this strategically, what can we put in place? We're going to have priorities set in place that's going to help lower this, and it's going to continue on a trend that continues, even when I'm sheriff, whenever I leave, or whenever Dave leaves, or whenever Kelly leaves, you shouldn't have to have a single steward that's be able to watch over, and all of a sudden when that person leaves, things then spike up again. You need to put things in place that has a strategic goal of lowering crime rates. We're going to address these priorities that are the high crimes, and we're going to put those in place, and they need to be sustainable for the long term.
I get that. So, Kelly, one of the largest causes, I don't know if large is the word, biggest causes of death, duty-related deaths right now across the United States for police officers and law enforcement officers is COVID-19. And we've seen that addressed around the country with these mandates to vaccinate all of the employees of a law enforcement agency. There's been some tension about it in the city. Now, the county has a more liberal policy that allows for testing. And so your deputies can get a test instead, I believe. Do you support a mandate that would require your deputies to get vaccinated?
Well, I definitely support the vaccination. I got vaccinated as soon as I could. We're doing a lot right now as far as the vaccination and testing and where our employees are at. We're following the public health order for the jails, where everyone who's working in a medical setting is required to be vaccinated. We have been for quite some time, having deputies in the jails show proof of vaccination or do weekly testing. We are beginning to have a lot of positions on our department that require vaccinations. All new hires are required to be vaccinated. The academy that starts in 2 weeks, every cadet in that academy is already vaccinated. And so we're working through that process. I think it'd be irresponsible for me to set up a policy, make a policy statement right now while we're still working through that as a department. So I'm gonna decline to state my position on that right now.
So the county's employee policy is pretty clear, though. Like, are you saying there might be a chance that you would resist it?
Resist which part of the policy?
That they either be tested or vaccinated.
We're doing that now.
Okay.
Yeah.
So what's the part that you're uncomfortable talking about?
Whether I would mandate vaccinations for the department.
Oh, beyond the tests. Okay.
Yeah, because we're working through those conversations right now.
Okay. Dave, you were shaking your head.
Yeah, you know what? law enforcement is a 7-day-a-week, 24-hour operation. The sheriff runs the jails. We don't have in law enforcement and the sheriff's department the luxury of closing the door and going home because COVID is there. Employees have to be there. Medical staff in the jails have to be there. The courts are back open again. What Kelly doesn't talk about is the deputy who died of COVID worked in the courthouse. There are staff, there are inmates in custody who are being exposed to COVID. And because these folks are exposed to COVID and you have to fill those positions, they're homesick, you have to pay overtime to fill those positions. We haven't even talked about the workers' compensation that must come in if you're exposed to COVID and the long-term effects of COVID. I am completely vaccinated. And for law enforcement, I am 100% committed to a mandate of vaccines for people that work in the sheriff's department. I don't know of a position in the sheriff's department that does not require, or in my opinion, that is not a critical position, from our dispatchers that work in a closed environment, to our clerks that in the jails that work in a closed environment, our deputy sheriffs in the field that have to respond to traffic accident scenes and talk to people, who investigate domestic violence and interview witnesses and victims, to interacting with children that may be victims of crimes or witnesses. We absolutely need the public to understand that the safety personnel that we put out there, that the sheriff's department puts out there, have taken all necessary steps to ensure the safety of the public and the employees that are responding to help them.
So if there's a 500 deputies that don't want a vaccination under you, that you would be fine if they left?
Your scenario is unrealistic. In my decades in the sheriff's department, you will have folks that will resist, that will say we're going to quit and leave. I just don't see that happening. You do not spend hundreds and hundreds of hours in an academy and phase training and get into law enforcement to say, because I have to get a shot, I'm going to quit and walk away. I just don't see that as being realistic.
John, it does seem like of all the difficult things we ask law enforcement to do, that this would be the one that they would walk out over. Seems hard for me to comprehend. What is your take on the situation?
Well, I support someone's right to choose. I really do. However, I will also support the law. I understand it's a contentious issue, and I know you had to ask this question. But, we also have many individuals in law enforcement who do support vaccinations. I've talked to many of them. I know Dave has talked to them, and so has Kelly. So there is a big number who do get a lot of press about the not wanting to have a vaccination mandate. But I will tell you, there's a lot of law enforcement individuals who, for all the reasons that Dave stated, they do want to get vaccinated, and they do appreciate the mandate because they have to be around individuals who are not doing it, and it's causing the COVID numbers to continue to spread. And and it also affects their families as well. It's not just those that they're working around, but they all have families, they have children, they have mothers, they have grandmothers that also then they go home and they have to deal with that. We as leaders have to make tough decisions from time to time. My time in the military, I can tell you, I had to make a lot of tough decisions. And
yeah, you're a Marine. You're a Marine. It seems like the military always has these sort of force protection situations where it's like, it's just not even a question. It's weird to me that this has become, what do you think caused this to become such an issue of trust?
Well, there's a lot of issues that became an issue of trust. Some of this it does spin out of some people that maybe don't have the full understanding of what the effects of these are and what they're going to do for individuals. But I can tell you, as you brought it up, there's a lot of things that I didn't agree when I was in the military with my superiors. But I'll tell you, is it legal? Is it ethical? Is it moral? Okay, well then we're going to follow the law. That's what we do. A lot of mandates in the military, the same as the sheriff's department, any law enforcement, when it comes down to it, cops and deputies, they follow the law and they enforce the law. That's what cops do. So again, I support the will of the rank and file on this issue, but in the end, whatever the law and whatever the rule that gets passed by the county is what we're going to follow.
Did you want to react to anything, Kelly, before I move on?
Yeah, I just want to remind everyone that we are following the public health order. We're working through this, we're navigating through it. We understand the concerns of some of our employees. And I do want to say that, you know, the perception that deputies or officers are not getting vaccinated or don't want to be vaccinated, a lot of it isn't because there are some crazy right-wing idealists. It's, you know, there's a lot of reasons. We have a large female staff working at Las Colinas who haven't had the opportunity to have families yet. Some of them still believe that this will affect fertility. So we're working through some misinformation. There are a lot of other reasons. I just don't want people to think law enforcement are looking at this from the perspective of just some crazy ideal. It's not that. There's a lot of individual reasons for people thinking this way, and we're trying to work through that as thoughtfully as we can while keeping the public safe with testing and the other things we're doing. We also offer the vaccine to every person who comes into custody. We only have about a third of those individuals take us up on the vaccine. We continually remind them and ask them if they would like the vaccine. So we're doing a lot, and I don't want the public to lose sight of that. So
Scott,
just to hold on, I just want to follow up on that real quick. You said that in Las Colinas, there are a lot of women working in the facility that are under the impression that the vaccine will hurt their fertility.
yeah, that was some early information that came out, I think, when the vaccine first started. I think that, you know, to Nathan Fletcher's point, there's some misinformation out there about the vaccine, and we really need to clear some of that up. As you said, I think in the beginning, there's some trust issues surrounding what the vaccine and what it is and what it isn't. So,
well, we're talking about jails, Dave. I would like to transition to jails, but do you have something quickly?
You know, 80% of the population in San Diego County is fully vaccinated. 90% in the South Bay. My daughter, who is pregnant, first-time grandparent, yay, did a lot of research on vaccine and was vaccinated while pregnant because it's a smart thing to do. What we're not seeing, and I've talked to a lot of the deputies that work at Las Colinas, the female deputies, who say there's very little professionals who have come into the facility to talk to staff about the misinformation that Kelly mentioned. Yes, there's a lot of misinformation out there, but it's incumbent on the leaders to bring the right information to the people. Incentivize them if you can. We've seen incentive programs work. I can guarantee you that if you incentivize those booked into jail and you offer them a vaccine, they are going to take it. I've seen it work in our facilities because I've worked in those facilities.
Let's talk about those facilities. Let's talk about jails. Obviously, there's been some, you mentioned, Dave, you've been talking about it for a couple of years. There's been a lot of stories, journalism by Kelly Davis, Jeff McDonald. We've done some work. There's a lot of concern about how many people are brought into custody. The sheriff takes charge of their lives, of their livelihood, of their health. They go to local jails and they die. The faces of them were displayed in the Union Tribune. When we take charge of somebody's life as a collective society and they die, it seems like there's something we need to deal with there. To what extent do you think, Kelly, that this is a crisis or a misunderstanding, or how do you talk about it and tell the story about what's happening?
well, yeah, certainly there's we're taking a hard look at that. We have been for years. There have been, you know, over, I think it's 10-year period, 11-year period, 154 deaths in our jails. We've had about 850,000 individual bookings into our facilities, and with populations ranging from 5,600 people a day pre-COVID to 4,000 per day average since COVID, and continuing with that number. 39 of the deaths over that period of time were suicides. We've done a lot of work surrounding suicide prevention. We've reconfigured our facilities. We've, instead of solitary confinement, we now have EOH cells, which are more, you know, the ability to watch people without having them have to be in solitary confinement. A number of those deaths, the majority of them were classified as natural deaths, which can be anything from a heart attack to cancer to underlying health conditions when they come into our facilities. We are looking at a number of solutions to, you know, we want to prevent death where we can. Obviously, any death is too many. We have had a number of overdose deaths due to drugs and alcohol. We have a very robust screening program to try to find drugs when they're in our facilities, but we don't get them all. Some of our screening processes, we have X-ray machines that when people come into custody, we have a very thorough male screening room. We do a number of searches, and all of our deputies carry naloxone. We've had dozens and dozens of overdoses this year that we've saved those individuals with naloxone and other life-saving measures. So we're working very hard. Our staff is working very hard. And as I said, if the state audit can bring forward some recommendations, we would really like to see that. So
you said there's been overdoses in the facilities.
Yeah.
What is happening that they're having access to deadly drugs within those facilities?
Well, I think there's always been drug smuggling into the jails. I know 36 years ago when I started, we were interdicting drugs that were being smuggled into the jails. It's nothing new. It's, people come into our custody, 87% of the men who come into our custody from Sandag studies are under the influence or have narcotics in their system when they come in. To come into a jail setting and go through withdrawals really drives someone who's got a substance use disorder issue to want drugs. There's active drug trafficking that occurs in every jail system, every prison system in the country. So what we do is everything we can to reduce that. We're going to be deploying a fentanyl sniffing dog soon. That will help. We do drug sniffing dogs of other drug types. So the first fentanyl sniffing dog will be online soon. Like I said, we screen mail, we search, we have X-ray machines at entry. We have amnesty boxes for inmates or people coming into our custody who want to give up the drugs before we find them. We do searches all the time in the facility, but it still gets in. And fentanyl is very small. It's a powder form and it's very easy to conceal. So
how come there's no actual like methadone treatment within the jails right now? How come there's no medical?
Well, there is
Okay.
in our, we've had the medically assisted treatment program in the women's facility for a while. We've just partnered with HHSA to expand the MAP program in our jails. It'll be going system-wide soon. I visited both Orange County and San Bernardino jail systems when I became undersheriff in an attempt and with the interest of learning more about what they're doing. Orange County has a very robust MAP program. San Bernardino has a MAP program. You do wraparound services with the drug treatment, which helps with the addiction problem. And then when they're released from custody, they can get resources and we provide them that help. So,
okay.
Scott,
Yeah,
Scott, if I may, because this definitely goes to the point about this issue, but let's take it back a couple steps, because the best way is to avoid these kind of drug overdoses. People who have crisis and they end up dying in jail, the best way to prevent that is to not put persons who are vulnerable to custodial situations in jail. Let's find ways working with our community partners to find other systems other than the criminal justice systems. We've been relying on the 911 system, law enforcement showing up, fire and medics showing up in the emergency rooms to solve this public health crisis. We need to start working more closely with our community partners and our county partners to find ways to give these deputies that are out there that get sent to this to have some alternatives instead of taking them to jail. And if we can do that, then we can get back to focusing on violent crimes and gun violence. And, it's all going to work itself out with this whenever you're not going to be able to prevent completely some of these jail deaths. I'm not going to say that's going to happen, but if we can find ways to mitigate it so we're not putting these people in there. So now you've got deputies are in a hard situation when they have someone who probably should have gotten some sort of drug treatment or mental health treatment prior to them being contacted by law enforcement. We can't put this all on the backs of the deputies and those that are working in detentions. That they do a great job, they're professionals, but whenever you haven't given them the full support of this public health crisis and getting support on the front end, you're putting them in a very tough position. And so we need to solve this. It's not just a sheriff's problem. It's a community problem. It's a county health problem.
It sounds like you're getting close to saying something along the lines of the sheriff and law enforcement agencies should be investigating the big things, the big murders, the big crime that people worry about, and that some of these other things should be handled differently. Is that a fair summary?
Yeah, well, I think it does need to be handled differently. We need to reimagine how this is done.
But you're a
I think
prosecutor of misdemeanors. Like, does it drive you nuts to be doing that kind of work all day?
Well, it doesn't drive me nuts, but what drives me nuts is that there's not been proper systems in place to keep us from it coming to us. It should never come to us. You know, we have systems right now that we're trying to put in place, like our Pleads program that we've been doing. It's been very successful, where law enforcement is taking individuals that have drug addiction and drug problems, directly accessing into counseling for that, as opposed to you take them to jail and then they eventually get PC 1000, 5 or 6 steps down the road. Meantime, it's taking up a lot of staff time. It's taking up jail time. It's taking up court time to get the same thing that they should be getting on the front end. Again, it's relying on the 911 system and cops and fires and medics to do it. You got emergency rooms that are getting overloaded by these individuals as well. We need to really have and I know it's always going to be said is that, well, we got no place to put some of these people because we haven't built the infrastructure in the county. Well, county's been saying that for many, 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 many years. And it's time for them to really step up and do it, instead of trying to push this all up on the sheriff's department and the law enforcement officers who show up every day and kind of get stuck with this problem of these individuals who are in crisis and they need something else.
Yeah, Dave.
Scott, look, as a prosecutor, you can dismiss cases no matter what comes to you. But on the facts of the jail bookings, 4 years ago, I talked about it costs about $80,000 a year to put an inmate in custody. If law enforcement has to respond to these calls regardless, and you have individuals who have personal use drugs, underlying mental health issues, the mindset of the officer showing up are, I got to find a reason in the penal code to arrest you and put you in jail because I have to go to the next call. We have to change that mindset. That mindset has to be, let's take some of that budget, let's reimagine policing, let's put those funds and buy beds in the community, long-term drug treatment beds, long-term mental health beds in the community through the sheriff's budget. Yeah. So when the officers do respond, instead of taking them to jail, the mindset is, I could take them to a treatment facility. But what we're seeing, and your paper did a story on this, the sheriff's leadership could not wait to change the booking criteria, notifying police agencies in the region that they will now start accepting misdemeanors again, even when we know that they have low COVID vaccination rates of inmates in custody. Community-based organizations are suing because of that. And then they gave you a booking criteria, which was completely redacted.
I will say, let's go back to the comment real quick about the budget, but I agree with Dave. Dave just said exactly what I said. We need to find alternatives for these low-level individuals that have drug and co-occurring mental health problems. But the county does have money to address these issues. It doesn't have to be on the backs of the sheriff's department's budget. If you look at the grand jury report from 2015, 2016, I think it was, there was several years where there was 80, 90, $100 million not spent on the behavioral health system. That needs to stop. I think, thankfully, the Board of Supervisors is making some strides right now, but there is money to take care of this. They just need to have the will and the leadership. We're gonna do ways. The sheriff's department has the ability, and I can tell you that I can point to Pleads programs that we did. We did the SMART program. All these things are things that we're doing to keep people, not only keep them out of jail, but to hopefully keep them from even going into the criminal justice system. And again, it goes back to Scott. Once we do that and we get a long-term solution for this, we can really start concentrating on the things that are important: violent crimes, gun violence, and protecting victims, helping the victims so the victims don't get left behind.
There are a lot of questions in here, but I have individual questions for each of you before I turn to some of those, and I want to get at those. So Dave, you just mentioned you want to reinvent some of these approaches. You've had the opportunity to do some of that before. In 2011, the legislature passed AB 109. It was a law known as realignment. Among other things, the law led to the release from prison of a group of inmates known as 1170s. They were considered nonviolent, non-sexual, non-serious offenders without parole or probation. You were the commander in charge of a program called Operation Lemon Drop. We did some reporting on. It used an algorithm to target those about 1,200 former inmates by setting up drag nets at trolley stations where they would use fare enforcement as a probable cause effort to check them out. You said the program targeted the worst of the worst. Do you stand by that? Is that the kind of thing that you would still do now? As sheriff, would you look for predictive, algorithmic, data-led policing like that, which you said was intended to arrest people before they could commit more serious crimes?
So the way you described it isn't exactly how Andy Keats and I, when he met in my office, talked about it. And I actually showed him an offender list of individuals who we knew were committing burglaries that were not 1170s, that were not subject to flash incarceration. And then what happened when we initiated Operation Lemon Drop is there were a group of deputies and the leadership there at the time that went out, and they did not do what they were supposed to do. They actually hoodwinked the enforcement at a trolley stop using fare evasion as probable cause to just stop anybody and ask them, are you on parole or probation? I shut it down and we didn't do anything after that similar to that. So that was not the way to use law enforcement resources. We did not do any other operations similar to that.
What changed for you when you look back at some of those efforts? Is it just that that particular tactic wasn't right, or did you have a more broad sort of awakening about what the trajectory of law enforcement was?
A lot changed for me. Levels at the my promotion to commander, what changed was my perspective on law enforcement. What changed was the expectation of my leadership from those below me as to where law enforcement is going to be in 5 and 10 years. My policing style has not changed. It's policing with empathy, with compassion. There are individuals that need to go to jail, and law enforcement needs to do that. And sometimes it's not a pretty sight, but law enforcement needs to act. And when law enforcement doesn't act, or when law enforcement internally doesn't act to move forward with changing police expectations, changing community expectations, that's when we start to see the flow of mistrust. When law enforcement, let's say, for example, does something wrong, and the community demands transparency in what happened. And then what I've seen is law enforcement circles the wagon. Law enforcement says there's nothing to see here. Sorry, Scott Lewis, Voice of San Diego, we're not going to release any documents to you. It's an ongoing investigation. And then the stories are published. Well, that's not exactly what happened, but we're not going to tell you what happened. And then you have ineffective community oversight. And so nothing's really changed, except for the way I view law enforcement going forward and the need to support hardworking law enforcement that are out there every day doing a good job, but then also taking a very hard stance on those that violate the public trust.
Okay, good. John, for you, one of there's a high profile case, at least among journalists right now, about a request or a threat that you made as a criminal prosecutor to a local journalist, Dorian Hargrove, about some documents that he had obtained confidentially, or they were confidential documents that he had obtained from a source. You threatened to investigate and prosecute him criminally for obtaining those documents if he didn't cooperate. Do you stand?
That's not true, Scott. I'll make sure we get the story straight. So
Okay.
I did not threaten to prosecute him.
Okay, what did you do?
We informed the reporter that we were conducting a criminal investigation, which we were at the time. And I think it plays itself out. As you know, there's a major criminal investigation going on right now with 101 Ash, but at no time did that letter ever say that we were investigating that reporter. And I think my boss the next day made it very clear that we never said that we were investigating that reporter. I was trying to be open and transparent because that's what we do. And we're trying to get to the bottom of public corruption. And at no time did I ever say that we were investigating that reporter, and nor would we investigate that reporter.
Well, you were investigating the crime that that got him that record, right?
We were investigating. Well, it was a large investigation. As you can see how it plays out, Scott, it's complicated. There's several things, but to release confidential information, the person who does that, the city has a statute on that. So that is a crime. That's correct. To be involved in conflict of interest, which is also a crime, which is what happened whenever you have those that are trying to do real estate deals, then they also have a financial interest on the side. So all those things are wrapped together. And it was a criminal investigation, which is what we were doing. And we were looking for cooperation at every place that we could get it. I would like to think that not just law enforcement, but the community wants to get to the bottom of public corruption. And like it said in that letter, we were conducting an investigation, and we would like any assistance that we can get. And for whatever reason, it was taken in a whole different angle. And that's not on me. If you read the letter, Scott, it's pretty straightforward.
Reread it. I think just in general, though, what is your approach to the press? You feel like they're to the press and to any member of the public that wants public information? Is access and transparency going to be something that we should worry about with you being in charge of the Sheriff's Department?
I think transparency and access is critically important. It's important to the public. It's important to law enforcement. It's important to the media. And that gets to the bottom of all this. If we're going to investigate public corruption, I would like to think that everybody wants to get involved in that. It's clearly an intolerable offense against our civic and democratic ideals. And so why would we not want to be transparent about, hey, we're going to be looking into this, and anybody that has information that can come forward, please do. Unfortunately, as you know, as you pointed out on this story, which it is kind of a popular story, it's taken lately, it's taken several months to get into the stage where we can finally get some action on the criminal investigation side of it, when you're collecting information. But it's been behind the curtain of secrecy for several years before it even got to this, because of those that were trying to undermine and not be transparent.
Scott, just an observation real quick. So I've been in law enforcement over 3 decades, and I'm probably the only sheriff's candidate here that has not either sued a reporter in federal court or wrote a threatening letter to a reporter to reveal sources. I mean, it's you write a I'll just leave it at that. Okay,
thanks. Kelly, I wanted to ask you, there was a really big controversy that made it nationwide about a video that the Sheriff's Department released that showed a deputy allegedly overdosing from fentanyl from simply coming in contact with it. And a lot of folks, analysts, doctors, medical toxicologists, lots of folks were saying that they believe that this would have a really deleterious effect on public understanding of the drug, of their willingness to help people who had overdosed, and could cause a hysteria that would have major ramifications for those things, and that you fed, or that your department fed into it by producing that video. Is that a video you stand behind that you believe is an accurate reflection of what happened that day?
We have a really, we learned a lot from releasing that video. We thought we were doing a public service because we truly believed that the deputy had suffered a fentanyl exposure, and that's why he collapsed that day. His partner believed that, and that's why his partner responded the way he did. We've been taught for years from a number of different sources that was absolutely what could happen with a fentanyl exposure. So it was really enlightening for us to talk to medical professionals after the video release. And, Sheriff Gore came forward and said he was the one who made that decision to release the video. But it really was something that, as law enforcement in the region and nationally, we believed was possible because of the training that we'd had. So the discussion with medical professionals was enlightening for us. And we're also looking at ways where we can, right now, regionally, the hospitals don't test for fentanyl. If you go to the hospital for a possible overdose, So we're trying to fix that. We're trying to find ways to actually test to see if someone has been exposed to fentanyl. We're reinforcing our training and the wearing of PPE when deputies are around fentanyl. That deputy that day should have done some things differently when he was working with the drug. So has
the video been retracted? It sounds like you're saying it's clear that you believe also that it was not a reflection of the truth.
You know, I'm not saying that. I'm saying I don't know. We don't have a test that day if the deputy had fentanyl in the system or not. He was using.
Sorry, I think that one of the things that this struck at was a concern that a lot of people have, that we can't trust the initial statements that a lot of law enforcement make about a crime, who's suspected of a crime, what happened, and that this played right into that it showed just how far an assumption can go before it's corralled. Is there any introspection or sort of analysis that's being done to figure out how to create initial public statements or communications that can be more trustworthy than that?
Oh, of course. Yeah, a lot more fact checking. I think, I don't know how to explain it other than I just did. We really believed at the time that that's what had occurred because that's what we had been taught and trained. And, there was this, now I think we have more partnering with the medical profession. That was sort of the first time we realized and the medical profession says the same thing. There should be more collaboration between law enforcement and medical profession, particularly surrounding drug use and drug exposure and all of the other things that are going on. And I think we did forge some of those partnerships after the release of that video. So that was healthy and that was a good thing.
Scott, it goes back to the fact that that kind of stuff, substance abuse and drugs is a public health matter. And it should have been some public health professionals that weighed in on that at the same time, because it's, again, law enforcement is caught at the very tail end of this when it should be addressed well ahead of that. And I think if you had a good marriage with the public health side of this and the medical side, which covers the whole spectrum of a lot of things that the Sheriff's Department does, you would be able to get great, accurate, and transparent information out to the public as quick as possible.
It goes back to the timeline again, Scott. When the fentanyl overdose or when the fentanyl contact took place, it wasn't until about 30 to 40 days later that a video was released. And I can guarantee you in that amount of time, sheriff's leadership got together at one of these secret meetings that you described in an article called the Critical Incident Review. And I would ask that all that information that was discussed and whoever was there as professionals discussing this to release that information. I don't think the deputies did anything wrong. They acted based on what they truly believed. And if you watch the video, you can actually hear the deputy who passes out say that he's had previous fainting spells and concussions from falling down. Now, that all leads to the idea of transparency and accountability. And I think that's within the sheriff's leadership right now, which we're truly, truly lacking, because that video, which is still up and on the sheriff's Twitter page, is doing harm to the good folks out there that are trying to help with this epidemic of fentanyl overdoses we are seeing in our communities.
Kelly, did you want to respond?
Well, we don't still have the video up, but that's regardless. I really am sorry that there was any kind of lack of trust related to the Sheriff's Department release of that video. We are very concerned about that in particular, but also fentanyl is a real problem. And that really is the message. And that's really the message that we had hoped to express that day. Those weren't actors. That was a real incident. The deputies truly believe that's what happened that day. He was taken to the hospital for a fentanyl overdose, and that was how he was treated. It's unfortunate we don't have a test of fentanyl in his system, but the medical professionals in reviewing the video believed it was something else. So
I want to make sure that we got so many questions here. I wanted to make sure you guys have a chance to do it. Some of them are more personal, some of them are more general for everyone. One of them for you, Ms. Martinez, you did announce that you left the Republican Party last year and joined the Democratic Party. Did you vote for Donald Trump, and what made the switch something you wanted to do?
I didn't, and I made the switch. It was really a personal reason. I just didn't feel like I was represented well by the Republican Party anymore. I never was political in my life. I grew up in a Republican family, and you just registered that way, and that's just the way you stayed for your life. But last year, I made a change. I'm not sorry about that change. And I also want to say that the sheriff is not a partisan position. I shouldn't, it shouldn't be partisan for any of us. What our party affiliation is shouldn't really matter as a sheriff.
John, I actually don't know your party affiliation. Do you have a party preference?
I am no party preference. I changed my registration a couple of years ago. That decision is personal to me as well. And like Kelly said, I believe the sheriff should be apolitical and nonpartisan and perform unbiased law enforcement in the county.
We elect a sheriff, though. I appreciate that sentiment as far as parties go, but we do elect a sheriff, and electing, running a campaign requires coalitions of supporters and money and all kinds of things. So it's, the election, I kind of bristle at the idea that politics itself is considered something negative. It's part of how we've decided to run this thing. So hopefully we can talk freely about it a little bit more. Dave, you're a Democrat in good standing, I guess?
Yes, actually, I was a Republican up until Proposition 8, and I couldn't be part of a Republican Party that didn't support me being able to marry who I love. And so I switched from Republican to Democrat. I think it was back in 2013 after the final Supreme Court decision.
Got it. There was a question from Julia I wanted to ask in here about providers let's see. Oh, there we go. Clinical opiate withdrawal scale and clinical institute withdrawal assessment for alcohol. So these are some things that she's mentioned that other jails have used to provide medical supervision while people deal with substance abuse. Is there a reason why those haven't been implemented in San Diego
They are
jails?
currently implemented in the jail. We do see with Cal.
Okay, good.
So
Thank you.
it's just the medically assisted treatment expansion is new. So that's what we talk about.
Okay. Does anybody want to?
Scott, let's go back. When was it implemented? And, why has it taken 165 jail deaths to implement something like that? I mean, you would think it maybe jail death 55 or jail death 100 or jail death 150. I mean, why all of a sudden, when an election is coming up, or are we now all of a sudden now seeing the implementation of things?
Well, I would say that for Dave's question that, this isn't really about an election. A lot of these changes and expansions of healthcare in our jails, they're things that we've asked for a number of years. We have a board right now that is very willing to support a lot of these ideas and give us, put money behind inmate healthcare. So that's really what this is about. It's not about an election or a change in sheriff.
So the sheriff's budget is nearly $1 billion, and Scott, once the County Board of Supervisors approves the budget and moves it to the sheriff has discretion over how to spend it.
Yeah, that came up with the question of healthcare. There was a brief row between the county board and the sheriff about providing healthcare at the jail. At the jails. How did that resolve, and how should it be resolved? Should that be delivered by county employees, or should it be something that is bid out? Maybe I'll start with Kelly and go around.
Yeah, no, it should be county employees. I think, and I wasn't part of that process, but we have about 23 or 24 medical contracts in the jails, everything from x-ray technicians to dentists to doctors. And there was an interest for efficiency's sake and better healthcare delivery to combine those contracts. And the model really throughout the state is that the contractor would bring their own employees in. That was nixed because we wanted to keep our own employees, keep county employees, expand the number of county employees in our system. So we put out another RFP, which would still coordinate the contracts, but they would use our healthcare workers, and we would hire more county healthcare workers. So that's what that was.
Does anybody want to weigh in on that, John or Dave?
Yeah, I'll weigh in. I think I know the Sheriff's Department is trying to pursue, some accreditation on the National Commission on Correctional and Healthcare. And I think it's a noble effort to get there. I think that most recent MOU that they signed with HHSA is a step that can be helpful to be more collaborative with the behavioral health side, which is what I've described earlier. I don't think that outsourcing is an appropriate way to do it because you lose some accountability on that. I think the county is guilty, in my opinion, of outsourcing and contracting out a lot of things over the last decade or longer, because then they don't have to manage it. And then there's not as much accountability. I think whenever you can do it, and we have some great professionals in the health and human services side, and we have some great health professionals in the behavioral health side that are more than capable of doing this. And I think that's important. It's a step in the right direction, but it's not quite far enough. I think we need to do more.
You know, it was widely reported that the sheriff's leadership met with this medical outsource provider prior to any announcement of the possibility of sending out an RFP about outsourcing services. That outsourcing RFP did go out. There was such backlash, both by the qualified employees, county employees, and amongst some of the members of the Board of Supervisors. The sheriff's leadership was pressured into withdrawing that and changing direction, and then sheriff's leadership had to disclose about this prior meeting. Now, we have very qualified county employees that can provide high quality medical service, but they have to be paid fairly. They have to be paid based on the circumstances that they're working in, the circumstances in which they're expected to work in, and the high-risk population they're expected to work around. And when you add 188 medical positions and you don't change the standard and you have record high, low morale, then what you get is this continuation of problems of jail deaths, lack of medical care within that system.
Yeah, there's a question that came in that I really want to, I'm so glad that Jeff, thank you for asking about protests and law enforcement reaction to protests. Obviously, a lot of those are police department, individual police department issues, but not always. And I think I've been to a lot of protests. I've seen, a peaceful protest gather. And I've seen the moment when police, sometimes very mysteriously, the majority of people who are there decide that it has crossed over to something that is unlawful, an unlawful assembly. And that at that moment, it needs to be cleared out or otherwise contained. That moment is usually the moment when things get a little weird. And sometimes, the energy level gets very intense. That moment, I think, needs to be treated throughout the county, throughout the country as a very special moment. Like that needs to be a very thoughtful decision when that is made, that this is an unlawful exercise of free speech. Would you all just take a moment to talk about exactly how law enforcement leaders, as you'd be the most prominent law enforcement leader in the region, exactly how you would advise that people make that decision to declare something unlawful and start to crack down? Dave, you want to start?
Yeah, no, that's a very good question, and it's very relevant, and we saw a lot of it take place. In my over 3 decades of law enforcement experience, I've been to literally hundreds of unlawful assemblies, hundreds of peaceful protests, where we actually escort the protesters down streets, down boulevards, or allowed them to sit and gather and make their noise and blow their whistles. And there is that fine line between public unrest, destruction of property. But what we're seeing here, and I'll give an example. So I live in La Mesa, and myself and my partner went to support the Black Lives Matter. And I would ask that my other fellow candidates here affirm that Black lives do matter, and that at that event, there was a kickoff point. And in this county, the sheriff is the first line of defense when it comes to smaller agencies requesting assistance. And in that case, the sheriff's office responded. And one of the candidates in this race was in charge at the Sheriff's Operations Center when those decisions were made on the use of force, the beanbags that were deployed, the pepper balls that were shot, the exchange of a shotgun round with training rounds in it to a La Mesa police officer who shot Leslie Farrakhan between the eyes. And so La Mesa took the affirmative step to do a very transparent self-reflection on what happened. And the sheriff's response was no response. No, we're not going to participate. We're not going to. I think there's an obligation. There's an obligation, especially as the chief law enforcement officer, the sheriff in this county that responds to help other agencies, that we ensure that there is a clear line of communication, who's in charge and when that decision is made on the use of force, what type of force is going to be used. So we don't have what we've seen in La Mesa, which was random acts where individuals were being shot with these devices, and where we have to have a state legislator jump in and create state law then, which then defines and describes what law enforcement leaders should be doing in the first place.
Kelly, well, let me ask Kelly, since she was addressed directly as having a role in that. Do you have a response or context?
Yeah, so it's not exactly how it happened, but I wasn't at the operations center, and people at the operations center don't make direct decisions about what's going on in the field. That's made by the officers or deputies that are being engaged at the time. Trying to remember everything else Dave was discussing at that time, but the La Mesa incident, the sheriff's department did participate in that debrief. We didn't say that we don't have any response. We worked with La Mesa as they debriefed their incident and did a very critical review of what happened. We did a critical review of the decisions that we made. That incident wasn't released to the sheriff's department until after midnight of the first day of everything that was going on. And I think, reflecting throughout the year, we need to realize that we have changed a lot of what we've done as a region in law enforcement. We've reevaluated our response when there's people who are demonstrating or having peaceful expression of their First Amendment rights. We have weekly, daily, every weekend, there's some event at the sheriff's jurisdiction of the county administration center. That's probably the main protest site or demonstration site in the region. We do an excellent job of protecting everyone's right to express themselves. The Board of Supervisors meetings, as you've seen, have been very contentious at times. Our deputies do a phenomenal job of allowing people to express themselves while ensuring that everyone is safe in those environments. We do everything we can to work ahead of time with organizers of events so that we're all working together to ensure the safety of everyone, that they have the ability to march and go through the streets and do what they need to do without being in any kind of danger or hazard. So I think we do a really good job. There was a lot of reflection about what happened last year. There's been a lot of critiquing and a lot of really hard look at how we did things and how we can do things better.
Yeah, if I may, Scott. Yeah, I think it gets back to kind of jump on the tail end of what Kelly said there. It was a tough time the last couple of years for law enforcement. Lots of protests. It took an incredible amount of patience for these deputies and cops on the street to do the job that they were doing. They're humans like the rest of us, and we all reach a point at some way. But I think the important part is that it takes clear leadership, and it's a pretty clear line. It's not gray on when you can determine that this is an unlawful assembly or not. It's a pretty clear line. Whenever violence erupts and you're starting to impinge on the constitutional rights of others, right? Because we all support the First Amendment and the right to protest, and everybody should have that right and show that their grievance towards government. But whenever you're also then starting to impinge on others' rights and you're violent, it's a pretty clear line. And I can tell you, it goes back to leadership. It goes to getting clear rules of engagement. What are those rules of engagement? What is the what needs to be done at the appropriate time so it's not confusing? I can tell you from my experience whenever I was running operations in Iraq, I ran three military jails. My The rules of engagement on how it was done was very clear and was very successful without incident. We ran support and stability operations around Fallujah in the Al-Anbar province. Why? Because clear leadership from me, clear guidance and support, and everybody understanding what are the rules. And if you're not following the rules, there's also accountability on the backside. And when everybody understands that going down the line, it's very clear. Everybody's walking in step and they understand what it is. Again, it goes back to just having some really good leadership on the ground.
Mm-hmm. Well, my staff took bets that I would go over, and congrats on who won. Let's wrap it up, though. I know that a lot of things were said, and I want to thank everybody who submitted comments. Obviously, there's a lot of interest in getting the chance to ask people who run the sheriff's department questions about a lot of long-term problems and issues. I wanted to just give you one last chance to wrap anything up that you want to from these discussions. Any question I asked that you want to follow up on, anything anybody else said, just a minute each would be great. Thank you. I'll start with John.
Well, Scott, I want to thank you for getting us an opportunity to come here and have this interactive discussion. It would be great. I'm kind of glad you went over. There's many more questions that I think we could have covered, and there's going to have some opportunities as we go forward. I think what it goes back to is my stance is what it's going to be is that, I am not in the sheriff's department. I haven't been in the sheriff's department, but I can tell you one thing I have done. I have shown leadership throughout my entire life. As a military officer, as a police officer, as a civilian, what I'm currently doing, that's what I bring to the table. And I think what I also do is, it's professionalism, it's fairness, it's empathy, it's transparency, it's a commitment to change. You're never going to find me stuck into something. I'm always going to be, I'm always listening to what's out there, trying to make that commitment to change, to do what's best and what's right. I think that's what's important here going forward. We haven't really had a true opportunity to choose our sheriff in probably close to 30 years, to be honest with you. And when you really look at it, this is a great opportunity for the public to take some time, get to know me, get to know the other candidates. And I think whenever all is said and done, I think it's going to go back to what's that commitment to change and who's the leader that can bring us forward with the sheriff's department. And they're going to find out that it's me. Thank you, Scott.
Thanks. Kelly?
Yeah, I'd just like to say that I'm the most experienced and qualified candidate in this race. I'm currently running the day-to-day operations of the sheriff's department, and we're not waiting. We're not doing things because of the sheriff's race. We're making changes now. There's a lot of important change that we're making. We're working really well with our county partners and our regional partners to stand up crisis stabilization units, mobile crisis response teams, more ability to house the unsheltered and the homeless in our communities. We're making a lot of changes in the jails. There'll be a lot of change in the next year as we seek accreditation and all of the other healthcare support that we're going to have in the jails. It's going to make our communities safer, and just working really hard while we're waiting for this race.
Dave?
Sure. I've served in law enforcement 35 years in a number of leadership roles. In my highest rank, retiring as a commander, it's time for a renewed focus on core law enforcement competency and a demonstrated commitment to rebuilding the community's trust. I am a leader in the community. I've organized and advocated for fair wages and employees and for their benefits. I've mentored deputies to value community policing as leaders themselves. My experience best qualifies me to be San Diego Sheriff. My name is Dave Myers. Thanks, Scott.
Thank you all. I appreciate it. I know it's hard to run for, well, I've never done it, but I know that it looks hard and you have to do a lot of answering questions and take a lot of time. And so I appreciate you all stepping up to make that effort and for giving our audience and those that will see this later the chance to see firsthand what you say to some of these things. So thank you very much. And thank you to Jasmine who did the translation. I know that's a lot of concepts to get across. So Erica.
Yes, thank you so much, everyone, for attending. Thank you to our panelists. We definitely did not have any sort of bet going, but if we did, I just won. So you be sure to keep checking in on us and on how Politifest is going at politifest.org. We'll see you tomorrow evening for our last session. If you've enjoyed this session, please sign up for our weekly newsletters. I just dropped it in the chat, that URL. There's more great stuff and great conversations to come. Thank you so much.